In this video, I want to talk about the difference between managing acute traumatic injuries in BJJ versus managing chronic overuse abnormal loading type injuries. Now, the process of managing these two distinct types of injuries is actually quite different. And if you need some advice on knowing the difference between these types of injuries, you can watch my video on that topic. Or if you want some advice on how to tell whether or not your injury is an acute traumatic type injury or a chronic overuse type injury, you can watch my video on that topic. The management of these two distinct categories of injuries is different for three key reasons. Firstly, the treatment approach. Secondly, recovery time expectations. And thirdly, and probably most importantly, the prevention of these type of injuries. So firstly, treatment approach. So with acute traumatic injuries, these normally need some sort of immediate attention. If it's a mild injury, that advice of RICE, rest, ice, compression, elevation will likely be enough. However, if the acute injury is something a bit more severe, you may need some sort of medical attention. A broken finger, may need a splint, that sort of thing. On top of this, when the injury has healed past a certain point, there may be some sort of benefit in following it up with rehabilitation type exercises. And normally for this type of thing, we're looking at things that improve the range of motion of a previously injured joint and also strengthening the area that may have experienced some sort of muscular atrophy while being immobilized for a period of time. But in the case of acute and traumatic injuries, the recovery process is actually normally quite simple. Something broke, something tore. You've got to rest or immobilize it for a period of time to give it the time it needs to heal. Simple. On the other hand, chronic overuse type injuries normally necessitate a slightly more comprehensive treatment approach that I normally break down into two categories. The first category is you've got to chill things out. If you've got a really sore, injured shoulder, you want to take steps to bring that pain down to a manageable level. That's the first step. The second step is the stage that's unique to chronic overuse abnormal loading type injuries. And that is you need to find the inherent dysfunction that caused the injury in the first place. Normally, this is some sort of movement dysfunction or bad habit or postural issue or something like that is abnormally loading one part of your body, causing it to break down over time and become injured. Now, importantly, this second essential step is normally the step that people will skip, meaning that you're only ever treating the symptoms of the injury and never the cause. This is why so many people who do BJJ develop these chronic, long-lasting, sometimes years-long injuries. Secondly, recovery time. Now, acute traumatic injuries typically have a much more predictable recovery timeline. So if somebody comes into my clinic who's just, rolled their ankle in a pothole, I can predict their rehab time far more confidently and accurately than I can for someone who comes in and said they've had shoulder pain for 3.5 years. Now, really serious acute traumatic injuries often have quite long recovery time, but those ones tend to be quite rare. Generally, chronic overuse injuries require longer periods of recovery due to the cumulative nature of the tissue damage and the need for that comprehensive rehabilitation to address the underlying factors that cause the injury in the first place. So that's just another reason it's a huge mistake to do what most people do and tend to treat those traumatic injuries really seriously, but to allow those more chronic injuries to just nig along and get worse and worse. The final factor is those prevention strategies. So while acute traumatic injuries may be more challenging to prevent entirely, sometimes, especially in a sport like BJJ, accidents do happen. But of course, you can mitigate against your risk of experiencing an acute traumatic injury in BJJ by using a bit of common sense, not scrambling too much on a mat that's, full of sweat, leaving your ego at the door and tapping a bit sooner than your ego might allow, not rolling too much with the 300-pound, white belt with an axe to grind, that sort of thing. On the other hand, preventing chronic overuse abnormal loading type injuries involves doing things like addressing your training volume and intensity, incorporating adequate rest and recovery, and as I've mentioned above, addressing any biomechanical imbalances or movement deficiencies through targeted exercises and corrective strategies. I hope you found that information useful. If you do need some more advice on managing your specific injury, feel free to send me an email at matsidemaintenance@gmail.com and I can give you some personal advice on managing your injury. If you found that video useful, please give it a like and subscribe to Matside Maintenance for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to help you train harder for longer and, importantly, as pain-free as possible.